Yolanda Torricini, and she does have a PowerPoint that she'll be working off of this morning. Yolanda?
Okay, thank you, Mr. Briscoe. First off, can we go ahead and just have our leadership who are on the line, anyone that's got on, to quickly introduce themselves, and then we can go into the presentation. Do we have anyone from our honorable delegates on the line?
Melinda, this is Delegate Stewart. I'm on the line. Good morning. Delegate Stewart from Fort Defiance. I represent Fort Defiance, Sawmill, Red Lake, and Crystal. And I am a member of the Resource Development Committee under Fort Defiance Agency. Deja.
Thank you, Mr. Stewart, Delegate Stewart, Shania, for introducing yourself. And I'm pretty sure people will be continuing to log in this morning for the presentation. So Mr. Briscoe, you can go ahead and introduce yourself and your presenter.
No, this is Rolanda Torricini. Shachanja Kenan Shatabai Bashchain Kachini Dashichedo Torricini Dashinale. I work for the Navajo Nation Breast and Cervical Cancer Prevention Program as a case management specialist. I do have a presentation here, and I'm in the process of trying to link it on to the actual. Can you guys see the slide?
No, you would have to press share screen so you could share your screen. And if you could please email your presentation to us as well so that we can share it with other delegates, leadership.
Okay, we will do that. I work in the Chinle Service Unit area, so that's where my work site is, and I do provide presentations depending on my audience. Are
you doing it off here?
I have it saved on yours.
Which one are you working off of? One on.
Mr. Briscoe or Rolanda, are you still there?
Yes, I just emailed the presentation to you, Melinda.
Okay, thank you. Yes, I got it. I'll go ahead and send it out. Okay, Mr. Briscoe, while we're waiting, I'd like to also see if we can get other delegates who have signed in to introduce themselves. If there's anyone that's signed in that has not introduced themselves, can you please go ahead and do so now before we get started? Delegate Walker or Delegate Crotty?
Deja, this is Delegate Crotty. Can you let me know how I could help with the presentation?
Good morning, Delegate Crotty. Thank you for joining us. This is Melinda
Nice.
from the Speaker's Office. I know that this week's theme for council, we were just moving forward on today's awareness for the month of October for breast cancer awareness presentation. And so Delegate Crotty, if you could, if you don't mind helping us getting the presentation started and then going into today's presentation, Shade?
Absolutely. Thank you, Shadeja. So I want to just thank everybody for participating on today's call in bringing awareness. The month of October has a lot of important awareness events. And so we just thank our partners at the Navajo Cancer Prevention Program for helping the council support and enhance how we can all be part of the prevention when it comes to breast cancer, how it affects our community, and how we can continue to support our women, but also our men who have had to face the challenges when it comes to a diagnosis of breast cancer, either their nodules or going for an annual PAP or mammogram, I'm sorry. And then also in terms of this awareness is how we can support our family members who do have the diagnosis and how they then have to continue their treatment, chemotherapy, especially in the time of COVID. We had to make sure that they, because of their immune system being suppressed in trying to fight cancer, how we kept their immune system up and ready to fight the virus and to make sure that they were safe at home. So I want to just thank Shada Rolanda for providing this awareness and some of the the medical history is important for our grandmothers and mothers to talk with their daughters about their own experiences, how they get screened and examined, and how they have dealt with cancer in their family, so that we know that the families can continue to support one another, and eventually we can reduce the amount of cancer prevalence here on Navajo Nation by increasing more nutritious food, making sure our waters are clean, making sure our land is cleaned up from radioactive harm, and so that we could just provide a safe space for our community. So thank you so much, Shadeja, for the Speaker's Office to present this, and everyone who's on the line to support all of the awareness, and remember to wear pink, and that we can continue to support one another. So yeah.
Yeah, Shannon. Oh, can you guys see the slide now?
Yes, thank you, Delegate Crotty.
Okay.
And yes, Rolanda, we can see the slide.
Okay, is there any more introductions? If not, I will be starting my presentation.
Thank you, Rolanda. Is there anyone else that wants to introduce themselves this morning?
Shmayeja, this is Thomas Walker.
Yes, go ahead, Delegate Walker. Good morning.
Yes, good morning. Yateko, the presenters out of the Speaker's Office, our staff, Shmayeja, the Age, Kohobi, Yashin, Atio Dautisi, Ado Yateto, the Dishinko, Ado Heto, the Dishinko. Tahiki Thomas Walker Dishnadita, the Western Navajo Agency, Aja Kahanst, though a Panashakwaja, Bishmas on Yahanatjacher, the Western Navajo Agency, 18 chapters. 5 of those chapters I represent. They are in my legislative district. Those chapters are Loop, Talani Lake, Bird Springs, Cameron, and Coal Mine chapters. Ide what Ado mention a shing henshin being petone, Bashin, what something should say that it's a excuse me a national Ahoda the get the Schneedo, Benashika, Shadot Neko. What Ella, Koyat Eque, Hadatsi Kiziki, Kojan, Didi Shitlahan Neto, and Hitlahadin Negiko, presenters, Koyat Eki, Pedak Echo, What Ella Ko, Shas Tweedo, Shazani, Shatak Oshije Keko, Eshinta East Kito, Ndahodil Negi. The colleagues on the council that are on this call, a good morning to each and every one. It's Isbahaya Aj in Sago, but that Adole Nashni will Yegido, she Atavidos As, and dot in the Dosti. We take a dot dato, Bena. Jo Quaggy, Bada has Tigi a bits Bada has Tigi a bits she does in a bits though Balcoins and though the tree by Nahadin what they call what the hecky Bahind, what the hecky Bahan bits had Nigger I see the question because the teens nan I saw. Quite echo. Ada rains at it all, not sosta. Avocado, not to spend and de hotachoko. Genetic electro, what elet odzens and a cohajon bepahan now to in sea kiss. Other barquazes and all bedridly. I don't a nip in nation. Junji Kado, need the Nedla, a Calvinit. They hold your casting or what. But they didn't Kagi a Sunday with the Hegiko. A chair what I should has Santo Shaki San, do a Massanet and let or not the Queen, not the Quishing hard all the court at Ashamasando, a tap of Mahach, to bed has said that though you what I should what. Not up a mother, not up a Massan Gido. I don't expect the husband. Other way, he must son at the not when sped the husband, don't him motto. Quaggy. A cohort D. Quebahan, a gidger is sunny. A could ego, a pansaki, so bear honey. Ado a bahaya, to barcoins and all the kiddy. Called Adashi Dyson Nils how I can help as an elected official of from our communities as a representative, as an advocate, and a policymaker, and as we say, we're appropriators also. So those roles those hats that we wear as delegates, we can certainly use. In a timely manner, certainly, and when approached for support, for help by individuals or by groups, communities, organizations. Jo hata she in case in that in case those opportunities. What they call and do hasi. Other Shumaya Chawin Sagi. Also.
Thank you, Delegate Walker. Anyone else that would like to introduce themselves really quick?
Good morning, Yate Bena. This is Delegate Rick Nez. I'm just glad to listen in here on this awareness of breast cancer. I do have aunties and sisters and nieces and also Nehemiah Jiro, Nehemasa the Halonda, and the door shikete doors no zit, the land so yawan just case. Just thinking, this awareness is good. It helps us to understand what our people go through, and especially our women and our sisters, I just wanted to listen in and learn more about this so I could share with others. And I just want to say thank you to Honorable Crowdy Koro, Nikasnahasan, Langito, and Ms. Yako, and all our colleagues. So thank you. Good morning, and I'll just stay muted on the phone.
Thank you, Delegate Nez, for joining us this morning as well. Is there anyone else that would like to introduce themselves before we get started?
So this is our delegate Nathaniel Brown. Navajo Nation, BCCP, BPP, Miss Rolanda Todichini, Hehet Quegi Ajanan Nation Inigi, Ado Quegi Hanegi, question on Nigita, though should date it, Genosing Eda, Anils von Kidate, Jonantkin, Huijin Ohila, Shinike. Besh bans anit lini ein castle la lane nikit the nebel na hilne ngado ba khunitsen ko ado sheya tropa hanchlo look up bashchin ki ani da she adot zalana da shinale ado le khao khot so ado den shatos ba sha is nel an le chilchin bi troha hot so do den hot so ado truden ische Koho could add the Nebanasha Ado question or Kalgate Nana Dolech the Hanegi Ado Shado Tyson's Aunt Olech Kahun Dolech.
Thank you, Delegate Brown. Is there anyone else that just joined us that would like to introduce themselves? We'll go ahead and get started. Go ahead, Ms. Rolanda. The floor is yours.
Good morning, Melinda. This is Peggy. I'm sorry to interrupt.
Oh, go ahead, Peggy.
Okay, good morning, everybody. My name is Peggy Nakai. I'm the advisor to the Budget and Finance Committee. My clans, the Bethajinan Shle, Hatsoi Bashichin, Kodichini Dashichedo, Tachini Dashanala, Kin Hojon de Nasha, Gehat.
Thank you, Ms. Peggy. Anyone else that would like to introduce themselves? Okay, thank you very much. And Ms. Rolanda, you can go ahead with the presentation now, ma'am.
Yananat do ade da is not agi do nana dan hinatigi ani adona enslenigi benkil chona ado shijin lenigi adona shanan nishans lahagi ho Navajo Nation Breast and Cervical Cancer Prevention Program aja ebanash nishto hashin so the adenek eche hut Hanegi, nicht ne, bitch, what they edo, but ishtana they needs and a cordi coje. It's but all that didn't say out of part, had no legi, have bet beat didn't say, Joy Hashil so stop aja bikia de hit on the I don't know that a large ya haela ya what need netla haela but out of ebita hotel atla di jishida no cynical. Ado a a large Banash Nishigi or Navajo Nation Breast and Cervical Cancer Program, Ain Hinan Nishbi Sidlahagi, a Hashin so Ahun Shane the Ben Hicho de Shach, Adon the AD at East but all or Yagi what about had no legi what's East a beat didn't say or Esha Iate Ain Le Azel in they go Western medicine they clinic a adego what all had negi is echo. Ado on the AD at Kodoba had negi Raji is Zefiki. dik at kaya tasa ande hut au kuja nahal jisho yati breast cancer awareness mat they know they yoje ko aja hashin so hut au hanne bi so lahagi do ba da honik zinit au do bikida di tigi au hut au ba da hui net le ko ado under da ya shisa zi do ado da shik dan le jo la ko ba da hos nan maya je do nana a be sani be khata hai so jegi do nana ni hit sit don hit ashi da halon hit so kedan hinalika sani dan denigi je can't dan denigi ko eshe khait au ba halon jo hashin so so kodo ba ya de kit do de Adonde da ko hot o binyenda hot a kosani ya anna hapik hot aber ben conduct the tla aja early detection aber say de hot o to pa bit isiki to pe not ista aber do hot o yet hadra to ye ta hon no jo e khashin so to e kodon hanegi bi sidla to adon the breast cancer warning signs kaila ay kaila e khatin shi do le ash sazen gi stan and strong as twin de what do ni so what and ko zel en ya asa the meat has tweet hiji ejo asa ado ko do ni so at no ya had net ko adon the reducing your personal risk factors for breast cancer ako jizini ginana ako adon the adle the nebazaje hot asa the case in the ligi to khashil so to kodoba hashnet do le Di kodoba nash nishige aja bahazano ya ta initiate on a mission statement the hadno ko ni hide go edit or a date nishiko to reduce breast and cervical cancers by engaging communities 18 hikain linigi keda hatenda halet au a yabaka di jato halet au a ya hot no zi ya hunzen no nagado de huinzen a hot au a ko we're gonna engage with our partners adon the to promote it and then to increase and improve the quality of health outcomes ni bach na ko halit on haya hunzen do de the abelaganik as ein hike it or think the nebaza jo abe bil khadna that's ashwa aya do it or think jo that on not ka e hashin son hinan shinigi de ko Nana division statement of Yagi a Yatin Hisani ni clinic healthy women ado eben nach yan hin hits ado and no chief but nach are the healthy families the art and na be hobikeya sa anike what all healthy families across the Navajo nation what oban CK so what all need indo what all a hashin so ni hit nan haya what no zi queen no what all a sad then you give what on the kitten that need net Nana di larger what on hinana should they need to engage strategic priorities if no yoje codes larger but they need the shige ni Navajo Nation breast and cervical cancer prevention program of Yahage Aja that's to focus the program resources Khayla a bitendalish Joquai a Winderock has anige or Haye there's the council there's the office of president vice president office or Hayita inish a the epohonetza what out katija a non lady what our kedahat inigisha remote areas a shekhay ad in hikado chahila beshishinda destroy ad what our improving access to quality breast and cervical cancer screening and services for our Navajo women no what all a sad then you get kate nanas I don't know kill to initiate the community-based intervention Zuzashka ei let's uzaka ein hike it do think but ado a what all a what no safe when ziniki community-based intervention da initiative ko adon da azel in the has ko a aja what out to promote cancer screening among our priority population ko a ya ba hodeshne khashe you see what all Sani and Yaya Hantaha Ka AI priority population Hadosh A Sikata Jish with Asani Begi Bob in the conduct this Klao ko Kao ne identifying the communities ko Hagi La Nahot Hadik what la you see what oh a thing and he didn't about the instinct a John that Kao Ado A Eben Nana oh a looking at the priority population to inform and educate to link them to the clinical services, navigating patient navigation, getting them to the clinical services. Increase access to quality cancer screening to reach the priority population. They need to identify and collaborate with health partners. Resources azil in it bindahas ano azil in women's health program. They know they use a sanin tabat nal in ko khando basta inishto this khando basta inishto this so that's for the evidence-based intervention. In hinanish linigi they needs in the call. Ado kana ya DK na be ko be kaya ha hozogi at khayis kit. Haigish see Nihinanish Linigi a day Nielsen a Kodi Koji a fixed unit isne. Zel in a bit that has undergo and del chill what all baby at the check or but they need niche I don't ko kianta I don't but they need niche do nana chin just I don't the best in the just Winslow what not sauce be as cut that need they need niche on the happy what need it not niche a call I don't that don't is what Nana get a what fixed unit they slini get azel in has ani get a pohone sani what but the conduct the doors latiki ya Azel and that has anige a non-BCCP partners a bazino a twinish what a asati what abananish a day so I don't the shipwreck so a what New Mexico they go what Department of Health a audit go stage niche nana crown point is also the nana echo non Georgia just nana Nana di koja taho toja zain in because anja a neither on the da on here with ni hid ne clato but non the spot days edo le study nido bin na ek at up it with non nishigi at na de slako nana a kid the aja mobile unit a thought she da e kon lay Azel in between the has ano what handle woko mobile services, mobile mammography screening services. A what a late inscription house the a what another a young late hot another zip a another zip big what to peso gi nante gi a sipo what nisha chimbi toja a need to go not so then you give baby hada that so I don't the Red Mesa Four Corners Regional Health Nana Pinyan just chinli just another what is just a what papa honet on the sunny hayi what anna hapik what but the kada del gladi given na and legit not what say legit tohachi nana legit na o de I don't later stop don't on the basin don't lay Flagstaff a knocker the hasna a arges and the art is so because on the Satoba nature what on hinan the state a koshik a doshit nedo adosh not only dice no angi ho a dick kodo job and his dish art late open on the shit they yosendo hard la a up on the state a she or wings in cook a den hit istan isla. Die Korea had nege yan lay a slatna hado stank at what on hinan the state egi at kodoba da with negi breast cancer screening a aja mammogram screenings they linigi ho a aja hashim son lay a slatna hado stank a what Sani be babin the kada that gladi give a coin art kit when not out the baka ko a you see being his joe they shali ge a ya di kodo na kyo na so hiki mammograms provided a ni being his joe na ane a ado a ya the qui a sani what other babin the conduct the jo a what late January 2013 to December 2017 jo a aja what a Hashin so aja when that not ya but in the cut a glad of course the meal double hardness nothing though beat at that double on te beat when that not big at kojin lay Najik what the no echo ARJA 4,355 base at a start of the meal bin not zagi a ya 80 konas ni hat ninigi altonies ibni klogo with all a ashon a zel or snata the hand or other with all asho yin yezel in the yanda kaha a altonies on it we love bin not a base at echo oh hayi Sani ne dan le kon de an le zel Egypt da do kache ko ebini na ek ko do saton hinan le shindenigi a de nils en hajob istan a de nils no ek at hun zata holjish ado tishi yisi ben ye hot o e ya klato da is no art is la I ni la ko di western medicine de shindenigi e aje neil kaho azel in bechata ho so je hot on de kato de nes o ko di koje the term cancer jo able lagonic at a hot out de yoje ni hije ko e at is but all that didn't say ado ba at had no ile ki jo e aje hot o ya had ne e din hits isigi e a de ya at is but all ye had it AI ne ko achait ahada hot o yati hot isiki anle asata haljen da hal kije dizad the quishi the meal hot obiga hotin hits is but only ki up in nature one nicht the human body cells they die off on their own. That's just the way our body functions. What it replaces the human body cells. Achait ahada sato up in nature what ya it stays in one place I don't know you know what that's a normal cell what haida at is but all that didn't say about had no legi to paint what no azel and nana the what but is paints the cancer cells bod no that the shadow no the nucleus station nigi see nanigi at odds out that the sha what they say eben nature what the what but is paint they get diagnosed with cancer with and there's over 100 different types of cancers within the human body that can affect Nike kodo breast cervical cancer ba da week ne eko lache yes da had the snow with abanast inkle eko what all a hashin so hinan nation then ge date eko nana di ko ya na had ne ge the cancer itself it's a disease that develops a T cell growth the shinigi it's isbit all so up in that when now nasi all yo inkle zan le that the what all a what all kat whatza outside the only speak at the Nakion and honest and get what all a what all yo inkat and nasi dikoj then at what all didn't say ho nasi on day what's east ho what all it starts to metastasize no what all ya had met like was in ado when abit said when the what sani and ya hata hakata what jo anna khapik na kinakh da bit na atle hoda what abet baben khanda tla jo yisibin ye what hinan the shide needs and not hin be sidlahagi what abit ishtana de needs and sani dan lenigi ho nana has twinned this jo ba hoshna what on ni lot and zel in ya anila ya ya ko what but nel do hashin sort do what had la no ko o shin ashin zel in the bana stato de anna khapik no ko ani hwan ni ko shik no kliniki others has twinned the nanda what do ni lot ho do stan epidet ita Di kodoya had negi 80 stunner with Albert Hadet Hajigo 18 lay lobes they kliniki. A aja hashin so a stunny tadota. That's what produces the breast milk. Di ducks kliniki 80 at osna had no she beat done iko. Yeah, that's what carries the ducts is what carries the breast milk. Lebe best touch it to the tip of the nipple. We also have what they call lymph nodes. They're also vessels di which beaten does Sani Hayido bespeda husband about the lymph nodes that they have Hajo baby which is net dobik ishtana Johnson no so Yahwins and Akoi anna the zid up in night kaho what sato name nishan they bitch yahone what other ness muscle the beat that didn't say ho but had long echo di koje what all the ness muscle the beat that didn't say ho da ya azel in she bunch do bitch do gosh adon the bitch ishtana is do dish Dila do kwa what eda la ne palate what zada to know the other binage this kid do they ado die the quick eda sa what ye was hot ne the issue zel all the bitch do as ado die the as ne zel in band but bitch it na the bitch know what baby ya just what ya di kuje in seho di abnormal cell growth kliniki Eshi hayid le nasi so what's happening to the abnormal tissue cells? It's growing into a mass, and a mass is a tumor. Di ado aja hajishiki epini na ekwado bande ni khasani dan linigi binya an hapik and yibet haban kanda the when it gets to that growing mass on this side, AAD, they do a biopsy. They nes must be nes sana e hajon that these ka. Tza what a bahazan a ko. AAD that's ani at least but all that ni saniki she ani but has linked to what a yen de ka benign if that's non-cancerous. What on they call what that niho nana ho bin ya hanna di dat adult die the achit the bench na huit the ajibin ye nahandi dat atskito the but that neko ado kojigo ge malignant they nini ge aj that's cancer kada what all they ho aj what all hashin so they have a care plan for them. AZ in the up with ya to khalate ya bakadi jato bakadi was with baby chahat kodi sani ya hata kagi ho the other hajisha ya abichi do ya with yin ya hata kaho bayat do ya bohonetza jo with itanil ko Nana di known risk factors ikliniki, AD na behoni kliniki, di race ikliniki, our nationality, our race. Tza ha ishe bin ye ein hiti na behoda ni kliniki, ayon hihodeshne, what on this kaho what ya da hunzen. Donana family history de kliniki. Lady no cheese jo no what on they car so lady da what all masanda na kitten masanda what all the bunch near the ya nana bitch eggy da what do nis da do what za da quite a bastion da nasli or the ajo da bait not in so and a family history I klinigi what are you in this car ya das kit in a hereditary that they know they use Nana di kodo anish not ani ye hati ko chiyan chideni inigi sashi abat hadno at echo eshi binina hajo Bata no sendich iyan chide no iniki. Iyan and dan seiki. Ashin yisin hits ispayat ehinde go ko. Di iyan ya di zenda da bigi iki o hayi a sheep tas kahot eko. Do nana di a shinkle kanne so. Jo o hayi a hot all ji yan dan they what's east hatte. Hashin so she not through the digestive system ako. She what's easier yata hoidos so eko. Hashin so stop bideti or la ko the diet that we have as individuals. It doesn't matter the gender ko. Aja abat hanot eko chiyan they need iniki. Nana di hormones de klinike ya aja hut on hitis hut est hudosani ni klinike hut o sani jigo le anna de zibik hut o ya beyond that but kana hadil just aja the hormones pass through ko aja through le no chief shine jo aja shi hut o aja satoshi but not esto ko nana di Hna ki shi sto bidet to de sto di aja anin jaga to hwa te ta a hone business dan jaga le ko adon nas hot aj anna hapik hot hot isiki ya yi tishi ho yan le na ti na khaya ta hot ad business ane do ad enta zigi dan jaha aja hot khod hun zat na ti na khay khatsta ya sahodo bohne za the hot isiki shi ti ki bini na a kwich so we're not as young as we used to be ho sato sto ba ta no senko we can't do anything about our age we can't go back 5 years 10 years bini na hajo ata hosia hajo ba ata no sendi azel ena ahot au binya za ha ki shi jo thi ho binya ti ya hanati ta ti binya nan or khata hote no sa a yisi to things in the edo shishidet ida other binya hot au ya hanati ta ta shijin da no da ko ada ota to nen zel en aniki bit hot au ya hata ho khato apet said what up in yandan hit the ka tin hina nish de ni zeniki what all khashin so khish yisi pa jo hot all shi so bansa case ko the mammography de niniki she yisin de ka the shpa banash nishido Nihe were federally funded from the Centers of Disease Control. Ade grant diki what all ashta nakapik aho e baka anda is iho e what all kodope they need nishako ben nacheko e ti inni bach aho na asani e khashe khashin zapathan na atle e what all ntabat nal e pa natal ka Azel ende go yinas asa anna khaton le na kina khapet khai le disdin ado yisi be khahaji shko sa abich to hot abadein ho to apo honet za hot abit not ihliki a konden hit koja sato babik enda si yahagi di peso no tahate from the CDC grant aje hot disdin donde skantin do ba anti aje hot babik enda si yo anna ha what ya ya ta ha nana skantin do ba shla don what beda khaygi to anda but not e konde ande azel in belkhaz ando aje hot yaik en nata atleho nta but not adoti ya a priority is given to women 50 to 64. Jo ezel en yahat now ajigo anna khapik adon da yisi da named ni hein like this din do snet be da khaygi hot anna khap hot begi baban kanda the club adon da supanash nishido the program that I work for they were required to allocate 75% of the screening for women pay for their screening for women aged 50 to 64 AD diagram we have the pink shaded area for 40 to 49 Adon the the teal one is 50 to 64, 65 to 74. Aja with AZ, and then Bishindahas, Ano with Oikindadnish. Adon the United States Preventative Services Task Force, they know what all AT Akea Atasa on that national go what all Sato Bay has ani beast. So he bay day need niche do a board known hinanish day needs and know what on day nish. We have to follow certain guidelines. That's one of them. The United States Preventative Services Task Force and the recommendation is every 2 years again for screening the Schnobahashne. We leave it up to the patients. This thing Schnacho Yahde Shatens also Bohonetza Adadi Nich Bakadija Aquata Inzen da Adon the Yahons and they didn't know this Adon the Enas no hot on Yahanata to this hard the shinley what obik had net to this in nature so did ya not a hito ka a co what all yasato bain that need hindo but ishana day needs and Nana di ani bahashnet. Lede stanna bebeta the nende sto hot all ines muscle that be no safe kodita that grego 80 kwaje hot all abahazin yet that grego Ashi you see hey des what all a stunner bebegi bub and the cut this cloud. A shashin lay what's in the what oiskis of like isn't here the abazin of what's in the lady done dan na asa ko hla ta 80 ko jo sanj ko hot ab be ben khat tlaw ein le de bazan ta ta gre ko e shi you see ben na che ba had no dan zo hot yin na in le ko e aj bin ye yin ye ya na do ta ado ha jo na do ka ko e ben na che ban sa case so the majority of the breast lumps that they find in a woman's breast it's not due to cancer. A lot of it is fatty tissue buildup that can, or dead tissue cells that can develop anywhere on the human body, both gender. It's not only women. It can be benign tumors, that's non-cancerous. Nana Disani, we go through a menstrual cycle on a monthly basis. There's changes on all of that can cause benign breast lumps as well. So just because they find a lump inside their breast or in their underarm area, that doesn't mean that they have cancer. They need to come in and get screened. Hajo azel in ba nato bit ishana inle ado on the tae ado na yehoteto astila ato na adneta na di sabin yeti not ade results again not wado ishai ha indi do de jo hot is ke na all yan hinan linigi ate nilzen ako ado on the tae ade it's still important to let your doctor know about any abnormalities that you notice in your breast or underarm area. Any changes that you find na anna disease anhin na ka kosani no tlinigi adenende sto hot 18 hibets sagi your nipple benago hot what on a nation neto les nes muscle that hot big is del niota yashi kwashi but not kopinya hasto gas ado bayada no sene sto harder that they what all a squida what all bait not in yet what all azel no sana tato de shido wins in the sto so eben not by yada cure early detection Jashi the cancer yagi at is but all that in cell but no leho ya sa lady sa de yo ene so do nazi he they know de yojin de ko early detection can actually save lives. Ebony na ekwadosa platobe that need kinako early detection of breast cancer it's associated with high cure rates. Abichido ado yao and ado biket all the hande ado what about papo honetza what o in ya hato kato azel in the bakato was Di koji ya had negi it's a normal bakagi hot all day nash edon de kahota. A aja hot all day do sel azel and then lenigi. Tiza a yesi azel and di koji yanad nishiki a oncologist they know de yoje. HED, that's the normal cell duct glands that they want to see. Di on your far left, the abnormal tissue cells are building up in there. Although the third one right there on your lower left side, it's becoming invasive. It's making its way out from the breast duct glands. A object at lebits east a ado aja khajisha a aja binya hot on dani tindo hot binya ya na. So there's the stages that take place after the breast cancer has been diagnosed. So the tilo na dogi shinti at hoti cancer or yagi ho. It's not gonna wait for nobody. It's not gonna wait for time. It's not gonna wait for someone to say, let me get a second opinion. So that's what all a binya a azel in the oncologist ikibajdo gati a kodosato ho atlo a bikek a hoshi ya there's a high cure rate for this o what ayada hadna and de kaho ado there's different stages sani what when they come in for their mammogram screening there's different stages that they see the x-ray of their breasts. Stage 0, don't lay 5, 1 and 2 is normal. 0, they're seeing some abnormalities. They need to come back in for additional imaging. 3, there's slight, we need to bring them back in. 4 and 5, the abnormal tissue cells all the hasli it's cancerous on that side, and they come in for additional procedures, whether it's going to be what they call a diagnostic or maybe a breast ultrasound, or else the oncologist might go straight to wanting to get a biopsy of the abnormal tissue cell. So both the stage and the type of breast cancer is very important. A agent for the treatment. They give what all cancer beings, it's with all the nesando, but hello, Leo a agent, there's a treatment plan for it. You seen yet they want them to go in and make sure that they're seeing the right doctor to provide that kind of treatment plan for them. The picture that you see here. They don't understand what's going on. Jo kompan sa keso bini na kodo the nebiza baby stahoid do baby ishan de nilzen ko di kojiba nahashne ko bayashke biopsy de kliniki. Nlay the sani when they actually get their mammogram, there's abnormal tissue cells. The only way that they can determine any human being, both gender, that can be diagnosed with cancer is through a biopsy. That's the abnormal tissue cell right now. That's what you're seeing in females' breasts. The lobes and then the ducts. So what they're going to do is they're going to take a portion of it out, or else they're going to take the whole thing out, a biopsy, and they're going to test it, see if it really is cancer. It's a minor surgical procedure that can take place in one day. They send that to the lab, and that results itself is going to determine the type of cancer it is. Under the if a treatment needs to be done, they're going to tailor it towards the specific type of cancer that they're talking about. Ako, ben na di de kwa sanin lenigi baby sinda hui ne ako. Sa danes muscle da what on they be bet they be ya hon da be ding se what da ye da ni ako. Zel en ban ya bazen no push it do ni tan zo da what ya don ya hata hakata anasi biket all hadde in the a tumor the snow bahashna it gets to that stage, and we're trying to prevent this from happening and occurring to our women population on tween the men folks. Ebony na ekodo hot obain that needs hindon hidden every chance we get, we try to go out there and promote and do the intervention and prevention with our outreach. Di breast cancer warning signs no yoje eko. Di sani baby sinda hashneko. Kwaje zel any nas indo ne kaho ebik aho hut nan tiniki ide eko. There's possible changes that could occur with the skin texture. It almost looks like an orange peel. Those are one of the breast cancer warning signs. Adon da a depression or dimple the finigi or your beak holds the high should be a day go hot down that's and they be best tagi but or that's a joy aja what all her job and yeah on night the z big and nice just call she ate the bar was the nosy which is ziniki apple what's isiki ho. Nana ti wa best sagi the nipple liki o beyond that what you now do up I did not now what your ace got but hello echo and that becomes an inverted nipple. Sani what on ya da ka adon that the and then they check to see when their last mammogram was. If it was more than a year ago, more than 12 months, they get the screening done. And if that result comes back normal, this becomes normal for them as well. They end up with an inverted nipple. A discharge from the nipple and liver best. Though there's drainage that can come from there, from clear fluids to streams of blood. You shouldn't have any drainage from your nipple if you're not breastfeeding or if you're not pregnant. They are the ducts and the glands are producing the breast milk. You'll notice that there's breast milk coming from there, from the coming out from the tip of the nipple. But if you're not doing any of that and you notice any discharge from your nipple, then you would be concerned about that. So these are some of the breast cancer warning signs. How can you reduce your own risk on hindasi zinigi ho? Di sani do ne not one of us' body is structured the same. Na go diha ado di na abkhanda honika. Sa ya tabi ne do bkhayata hot eto di ku ahait ahada but ispatahas anigi ya apahata no what on jono bit jono ya ata hadyado what ya tahina ko. So when an illness or an ailment starts to take control of the body, so our body is going to react differently to it. Each individual, it's not going to all be the same and work the same on everybody. But your risk factors, how are you going to reduce that? You don't have to be doing strenuous running or anything like that, even just walking. Some people horseback ride, some people ride their bike. As long as you're active for 40 minutes or more per day, that's all they ask is 40 minutes. You can do 10 minutes in the morning, in the afternoon, in the evening, 20 minutes. As long as you're doing that 40 minutes or more per day, you're gonna be physically active. Ado shi e wat khaya hot e te ko o wat o ta hot di zehigi ita just ado under ta e ya ho achinda be nani da halon da hot o e sato. You get everybody involved and you stay active, you stay healthy. Nana dich iyan bahashne a aja hut our diet. Jo e aja about halon echo more fresh fruits and fresh vegetables. A aja hut in the kaho. They digest a lot quicker than something that's in a can or something that's already sweetened with sweeteners that are not good for the body. So it's better to eat a lot more fresh fruits and fresh veggies. Our eating habit, having to stay on the healthy side. You'll reduce your risk factors. And I always say, whatever your reasoning is, it's good to start cutting down as you get older. What's isigi ado kwa ba no sin the bana do itlano do chin harder the late di ebike hadin do donayat etan isto bayat eta di legi she you see bitch na jisnate Diego bat not kunza go stoko ebony na no way no shin satonda no tiendo ni tinon hayat de ado di de eya ni hinas be hanas da is no sangi the nebuzaje the Navajo translation just 2 words right there, breast cancer. Because our language is very unique in its own way. We literally have to describe what it is we're talking about. But not you see the Navajo font there on how to say breast cancer in Navajo. Because we're giving our patients hope that even if they have an abnormal results or if they end up getting diagnosed with cancer, at least they're coming in at an early stage. They're going to do something for you. We're going to help you from the Western medicine. So this is the term that we use. It's broken down right there now in the bullets right there, the black bullets to your left. That's the human body cell. It develops and it starts to grow. It's uncontrollably, it's developing and growing and it becomes abnormal. This last bullet here that describes the actual organ, the body organ, cancer based, that's where you put that in there, that's in the breast area. As you can see, I didn't say a son of a bet because I mentioned earlier, it's not only pertaining to women, it can happen also to our men folks. The ones that come to that support, and also they bring their spouse or their wife to their appointments. We always get that opportunity to educate them as well. And abazno nan tin bakagi dan de lahle ado einle hawande kwent di sharchnigi dostra wat ada noda wat abe katoben da nil tin ko id wat asadigi chde nil ko shik edo shnat ani da no linigi ho net zanit o eyan hizad linigi ya chde nil ko ko de e panash ni shige e bazno ya bitch that they nesto bitch at how they let that no so a konda baka ko the breast and cervical cancer program, Navajo cancer prevention program, a aja with we have our program address on here. Ado besh behane igi to ho baka ahit ada nada dil kitano so ado dai the agada. If we have time, you guys have any questions, I'm willing to answer any questions that you guys may have. We are also on Twitter. Then we also have our website. Adonda, we're on Facebook as well. Ahot on hinanashin linigi date eto ahot o eya pain hilch oh na ado de teacher a heha eya hunzata de shisino a kashin to nihilna sasnet.
Thank you, Ahiahat and Skago, Rolanda, for your presentation. The Benbiyajit for the outreach and awareness for the month of October for breast and cervical cancer prevention. Akosh a khayta ayash andaidosh kinde or anyone who has joined the line that would like to introduce themselves. Does anyone have any comments or questions? Okay, thank you. There are no comments or questions at this time, and we just want to extend our appreciation to the Navajo Cancer Prevention Program for coming on board today and continuing our week-long theme for the Fall Council session. And today's category was breast cancer awareness. And so we like to just say thank you very much. And we actually do have one comment. Miss Flora Ben, would you like to make a comment? Okay, there was a hand raised, so I thought there was going to be someone that would want to make a comment. But at this time, we'll go ahead and conclude our presentation for this morning. Then, oh, go ahead, Flora.
I was just going to stress that to emphasize that women are not the only species. Men do get breast cancer too.
Thank you, Flora. I did mention that multiple times during my presentation.
Oh, I'm sorry. I kept going in and out. Yeah, Rolanda.
Thank you.
Thank you very much, everyone. Thank you, Flora, for your comment, and also again to the presenters this morning. May you all have a great day, and thank you for joining us this morning.
I have a question.
Oh, go ahead, Ms. Nakai.
Thank you for the presentation. I really think that this is really good information, especially for the fact that it's given in our Denebazad. I didn't know some of those Navajo terms for cancer and stuff because, as public officials, we do get asked questions by people when we're out among our chapter or out in the community. And they ask us, and sometimes, we don't know. And so we just have to refer them. And so I think more and more of these presentations in Navajo are really good and useful so that, as public service workers, we can share this information with others. And I was just having, I was thinking, it would be good if we had information about how often do you have this information provided to the public. I know, I think is October is breast cancer prevention week or month, is it? And then it would be good to inform. I mean, I wish more people would have listened. I saw that there's only about 20 of us that listened to the presentation, but it was really good. And I appreciate that. Thank you.
Thank you, Ms.
Thank you.
Nakai. This is Melinda. Just really quick, we are live stream on Facebook on the Navajo Nation Council webpage for this presentation. So even though there were a few callers, we are streaming as well. So, and then I'll hand over the other questions to Ms. Rolanda.
Thank you for that. The information that I provided was normally given out at community events wherever we could schedule ourselves to set up, whether it's the chapter, any functions that are going on. We normally host as well and do our kickoff every year, but due to the pandemic, we had to restrain from going out and minimizing the amount of direct contact that we're doing. And we try to utilize Zoom to try to do presentations like this. There's other late in that college, they wanted us to do a presentation on our program. The actual work that we're doing, and it's from their public health bachelor's degree program in public health. Other than that, we were out there. We could sit in the waiting area of the hospital that we're working at, or we could be outside at the flea market. Just anything and everything to do the intervention and prevention. Once we're given the green light to go ahead and do our outreach again, our public education and outreach, and then we'll be out there again. Other than that, we just put up our brochures and all at most of the hospitals and the clinics that we're currently working with. And then you have our website as well. It's posted right now, so you can also link on to that. And then we have information. If you feel comfortable and we know that you're gonna provide you want a presentation provided by us, we got to make sure that we are reinforcing the 6 feet apart distancing and all that. So then I'm comfortable with that. During the summer, that Cornfields chapter, summer youth employment, I did a presentation and we did practice all of the 6 feet distancing, mask and everything like that. It just depends on where it's taking place, who's coordinating it, and there's a lot of communication involved. So this can be done, and I thank each and every one of you for listening and the live stream that's available. Our phone numbers here. You guys probably know that I'm on Facebook as well, and you guys can go ahead and contact us through there if you guys would like presentations done. If you guys would like this same presentation done at a certain location, let us know. We're available even in the evening. I'm willing to give up my a weekend, a Saturday, Sunday to do a presentation like this as well. Anything to do our public education and outreach on breast health.
Thank you, Rolando, again for your presentation and response. We'll go ahead and hand it over to Delegate Herman Daniels Jr., Shiaj, to make the closing comments and remarks for today's presentation for Fall Council session. Shiaj, Delegate Daniels?
Yes, good morning. Shama arunda kodo da ino slagi kodo sel kahat things kodo zanshi adequate and kodo should negate object to shan to apikin and not for ebanash kodo as their council delegate kodo adonana kodo. I listened to the presentation called on him this morning kudo. This is a very, very good presentation kudo. So I see need edu kudo and can the man lenigi yahwan zandaho. So kudo dam I date she dam I see kudo a yahwan zando lessons and kudo a son it a ya that jo no ibahon neko as twin the jo hot I so a border dot no that job kudo. So I really appreciate what you guys are doing. Kudo na gay dam kudo bahanegi that today I don't know kudo o shimben hit at the seki kudo o shen hit on hidi need or less at this morning kudo dam presentation that sagi kudo so 81 for o shen hidi need or less go. So thank you kudo shma. Thank you.
Thank you, Ikihat, Delegate Daniels. Thank you, everyone, for being on the call. Have a great rest of the day, and take care and stay safe, mask up, and look out for one another. Thank you, Ikihat.
Thank you.
Thank you.